Okay. All right. I want to consult with you on this assessment that I did earlier.
Okay.
18-year-old male, referred to us by probation for a battery resulting in bodily injury on his mom.
Okay.
Definite chemical, definitely some drug and alcohol issues there.
Okay.
Has had his alcohol, marijuana, hydros, and Xanax. Significant use from starting at the age of 12 all the way to he's 18. So,
Daily on those? Or
on
binge use? What?
on
what
the pills, he would do 1 to 2 times a week, is what he said.
Okay.
But when he would use on those 1 to 2 times a week, he would take anywhere from a half of a 10 on a hydro to a couple of 5s or a couple of 10s a day. And then on the Xanax, he could start out with a half of a Xanax bar to 2 bars a day. Yeah. And then alcohol, you throw that in there.
Which could have killed him.
We absolutely could have killed him.
Mm-hmm.
2 to 3 sips starting out, and can now handle up to a 5th. Has had times where he only intended to have a couple and wound up using and drinking more. Has tried to quit before and went back to using. Has used while on probation. He had a positive baseline screen for marijuana and benzodiazepines.
Is he
with
still
probation.
drinking? Did he say?
The last time he drank, he said, was 2 to 3 months ago. But he has smoked marijuana 2 days before he went on probation and took pills 2 days before he started probation, which would explain why he tested positive on his baseline screen with the pills.
For the benzos, for the Xanax.
Yeah.
Okay.
No evidence of sociopathy, no anger. Here's where it gets tricky with this kid. Mom and dad divorced when he was young. And when I was going through the assessment and I got to the drug and alcohol history, the drug and alcohol use started after mom and dad divorced. Shortly thereafter, mom and dad divorced.
Coping skill.
So I went back and revisited the divorce with him and said, hey, let's talk about that for a minute. Did you live with mom? Did you live with dad? He lived with mom, seen dad on weekends. So then I dug a little deeper with him, how did you feel about it? Were you sad, mad, angry, yada, just different. He doesn't know. But he presented red in the face, teary-eyed.
So he's oppressing all of that.
Mm-hmm.
And something's fired him up with mom.
Yep, that's what I think.
I think there's a lot of buildup. Plus you have the drug use, especially the Xanax, the drinking.
So what I've established is I know he doesn't need batterer's intervention program. I know the battery was on mom, but because he's 18, I just don't think the batterer's intervention program would be the right fit for him. I think he would benefit more from anger management, get him some coping skills, because he acknowledges he has anger issues.
I agree. I agree. Anger management would work better
And getting
for
him to recognize that anger.
Yeah.
What I'm not sure of is if we need to do IOP with him, intensive outpatient program, or do we do the intensive outpatient program, hold off on the anger management, or do we do anger management first and then the intensive outpatient program? Because I think the core of this guy's problems stems from not dealing with the divorce of his parents.
Yeah.
And he's using the drugs and alcohol as a coping skill.
Yeah.
A way to cope with it, a way to deal with it, a way to suppress it.
Well, honestly, if we're going to go with anger management, that's 2 days.
Right?
So we can, hit anger management, get it out of the way, try to get through to some underlying issues. We already know mom. It may all stem from the divorce.
Right.
And he may just be lashing out at mom because mom's primary
Okay.
person that he's with, opposed to dad. So yeah, I think I would go with anger management, and then he's gonna have to have some kind of drug treatment. I'm not gonna say that he won't stop once he deals with
Right.
the issues with that divorce, but we could also consult with Marilyn on that too, and have her look at divorced parent things, with
Right.
with her history of
Right.
working one-on-one with people, especially with his age. He's 18.
That's where I was.
We
really
talked about
struggling
that
with
19-year-old that I have, that has
Yeah.
mom issues,
Mhm.
and drugs are that coping skill.
Yep.
If I can mask my anger toward my mom, I don't want to deal with my anxiety through medication, so I'm going to use illegal drugs. It's kind of what he's doing.
Mhm.
I'm going to suppress my anger. I'm going to drink that away.
Right.
I definitely would start with the anger management, because you're right. The battery, even if it said domestic battery, I'm still not going to look at an 18-year-old with
Batter.
BIP.
Right.
I'm
Right.
just not. They're not there yet in
Okay.
relation. You good with that?
Yep. I'm good with that.
All
Thank
right.
you.
Not a problem.